Hello and welcome to the Biohack Her podcast. I'm Azra Alagich, your host and founder of Biohack Her. I'm an integrative nutrition health coach specializing in longevity for women, a health and wellness journalist, writer, corporate consultant, and a biohacking advocate. Biohack Her is a space where we can explore ways to optimize our health to live well longer, whether it's through improving our nutrition, exercising, cryotherapy, supplementation, technology, and more. I'll be bringing you information and interviews with the best longevity experts to help you understand what you can do to optimize your health, prevent disease, and slow down or even reverse the symptoms of aging by taking control of your unique bio-individuality. Want to know more? Let's dive in. In today's pod episode, I chat to Dr. Adam Gavine, co-founder of the Wasabi Method, a partnership with Dave Asprey. I saw Adam treat many people at the biohacking conference in Dallas recently, transforming their long-suffering pain, some who have been in pain for many years, but were given instant relief after just one treatment of the Wasabi Method. Adam, a qualified chiropractor, breaks down how the Wasabi Method works and why it provides such quick relief for so many conditions. We also discuss some of the interesting work he's doing in using the Wasabi Method to treat erectile function and women's sexual health issues. Adam has an in-depth knowledge of the human body and is passionate about treating and educating people about how to biohack their way to well-being, health, and fitness. I hope you enjoy our chat. Hey, Adam, welcome to the pod. How are you doing?
I'm doing well. Thanks, Azra. Thanks for having me on.
Great to have you on. We connected at the biohacking conference in Dallas not too long ago, so it was great to organise to get you onto the pod to have a chat about Wasabi Method. What inspired you to develop the Wasabi Method for shockwave treatment?
Yeah, well, I'll try and give you a short version. So I was working for a company that sells shockwave devices for the past 12 years, and they would have me go to other countries like China and Malaysia and Thailand and Korea and stuff and present to universities and hospitals. And like, I remember one time I went to Korea, and I had like 200 specialists in the room. They're all like orthopedic surgeons, neurologists, neurosurgeons, ENTs, and they're all like hanging off every word. It was really interesting, because I'm like, this would never happen in Australia. I'm like, most specialists don't even, listen to someone like me. And all these guys are, when I said this to them, they were all like, oh, no, that you have knowledge and wisdom that we don't possess. And that's why we kind of not revere, but that's why we're interested. And that's why we're here, to learn something from you. So basically, I wanted to share this knowledge with the masses. And I connected with Dave Asprey a few years ago, and he was very interested in Shockwave, and it kind of just developed from there. And yeah, he was like, do you want to do something together and push this in the United States and get it into people's hands, because it's super safe, it's super effective, and it's a real shame that people don't know about the technology, because it is safe and effective.
Yeah, well, shockwave therapy has been around for some time, right? So run us through what shockwave therapy is, and then how Wasabi Method differs to traditional approaches.
So shockwave therapy, it's been around for since 1980. The original one they used was for treating kidney stones. It's called lithotripsy. So they can break up kidney stones they're essentially just acoustic sound waves. And so if you imagine kind of like someone hitting a gong, that creates these sound waves. When it hits, the drumstick hits the gong, it creates these sound waves. Now, when you put those sound waves into human tissue, soft tissues, it causes physiological changes to the tissues that they're applied to. So if the energy's really high, it actually causes things to break down. But they noticed if you downregulate the energy, if you make it from high energy to medium or low energy, it has an anabolic effect. So it helps things grow and heal and repair rather than a catabolic effect with the higher energy, which is somewhat destructive. And that's why they use it for kidney stones and stuff, because it'll break down that kidney stone.
You're right. So what are the key components in terms of the method that you use when treating patients? What are the steps involved?
So it's just like any other therapy. You have to firstly know what you're dealing with in terms of diagnosis. So you got to be able to figure out what the problem is, and you have to work on the appropriate tissues. So, like I tell people, if you have an elbow problem and I work on your foot, well, it's probably not going to have the greatest effect on your elbow problem. Now, there are always indirect problems. So sometimes you might have, through anatomy trains, we know that, the thumb connects up through to the shoulder. So I might have to work on your thumb to fix your shoulder problem. But for the most part, it's having a good diagnosis. You might need some imaging. So if it's again, we go to the elbow problem, I get an X-ray, it shows nothing. So then I might have to get an MRI, and then it shows that you have a problem with the tendon, what we call tendinopathy. So then I give people a treatment program. Usually it's based on how chronic the problem is, basically how long you've had the problem for. Your age, your health, all these things come into play, because you need a certain amount of time to recover after the treatment. So the treatment itself kind of stirs up the area a little bit. So we cause a little bit of acute inflammation in the area. So I want that to heal and repair before I can treat you again. So I can't do it every day because your body hasn't had enough time to heal and repair from the previous treatment. So we got to spread them out. Most people we do about once a week for most conditions. That tends to be the standard protocol for most things. Now, if I have a patient, say someone comes to me with an Achilles problem and they're like, oh, I have a competition in 2 weeks' time, I ramp up the treatments. I might do 2, maximum 3 a week, just because we're limited in the amount of time we have before they have to be good to go.
Interesting. I think the word shockwave sounds scary, quote unquote, right? So,
yeah.
And you're like, okay, what am I actually signing up for? So what does this look like? Is it a gun? Describe it for our listeners so they have an understanding, a picture in their head of what it looks like.
Yeah. So it kind of looks like a gun. So it has a long kind of barrel, and inside the chamber, it has essentially like a bullet that gets pushed. So it's all a pneumatic system. So there's compressed air that's attached to this handpiece, and there's controlled bursts of air that push the little bullet. It travels along the chamber, maybe 10 centimeters long or so, and then it hits a metal tip. So if you can imagine that metal tip being like the gong, and the bullet's hitting that gong, and it's creating these sound waves that's coming out through the tip. Now, those sound waves, they don't travel through air very well. Like, it loses all the energy in air. So that's why we have to use like a contact gel, similar to like ultrasound gel. It's the same thing with ultrasound. You lose all the energy if there's no medium, like a water-based medium that helps it get into the tissues.
Yeah, okay. And so describe what it feels like to get a treatment. What could a patient expect to experience in a treatment?
So it's somewhat unpleasant. It's not pain-free. So I tell people, if it doesn't hurt, I'm not doing it right.
Right.
So it should hurt a little bit, but we can control the settings of how intense it is. So I always work based on people's feedback. So I never want to exceed a 7 out of 10 on their pain scale. So I always tell people, if it's more than a 7, let me know, I'll turn it down. Or sometimes I'll move it to a different spot that's not quite as tender. So certain spots will be more painful. So say if I'm doing my elbow, if I have like golfer's elbow, it'll be really sore right on the bone. So I might not want to start there. I'll probably work a little further away and then gradually work my way up, because during the session, it creates a local analgesic effect. So I'm going to kind of numb the area somewhat. when I'm treating. So by the time I get to that really nasty spot that's very intense, it will have, the nerve sensitivity will have gone down a little bit due to the analgesia.
Right. So how is this type of treatment better than other types of treatment, whether you go see a chiropractor or an osteopath or something like that? How does the Wasabi method either complement that or is better than that?
So yeah, I wouldn't use the term better. It's just different. It's a different approach. It's a tool. So just like a carpenter has many tools in his toolbox, he doesn't say, "Oh, my hammer is better than my saw." It's just, if he encounters a nail, well, then he selects the appropriate tool. So he gets the hammer. If he wants to cut a piece of wood, he selects the saw. So the cool thing with Wasabi Method is there's loads and loads of indications. You can treat so many things with this device. And again, it's super safe. It's been used for musculoskeletal conditions for over 35 years. So it's not new. We have loads of peer-reviewed journals showing its safety and efficacy. So when people are like, "Oh, is it safe? Is it effective?" I can actually prove to you through peer-reviewed journals that it is safe and effective.
Mm. So in terms of the types of conditions or injuries that you can treat, what's it
Yep.
particularly effective for?
So the one that's most renowned for is the tendon problems. So like tendinopathies, which is the term we use in allied health and medical settings now. They used to call it like tendinosis or tendinitis. It's
Mhm.
all essentially the same thing. So tendons notoriously have kind of poor blood flow, so they don't heal the best. So for instance, if I tear a muscle or something like that, it usually takes about 4 weeks to heal because muscles have really good blood flow. Whereas a tendon, if I tear a tendon, it can take 3 months to get better. And that's if you do all the right things. So it's just a notoriously difficult condition to treat. And so this is really good at enhancing the healing and the repair of these tendons. Another thing it's really good for is osteoarthritis. So there's been loads of studies on knee osteoarthritis, which is commonly very difficult to treat non-invasively. They just give people pills and, either that or they get injections or they have to have surgery. So this is giving those people a fourth option that's, again, non-invasive. There's almost no side effects other than you can be a bit sore for a day or two after a treatment. And again, I've had really good success anecdotally in my clinic with a lot of people. Like I just had a patient in last week. She's had chronic knee pain for like 10 years and she didn't think I would be able to do anything. And she came in for like fourth visit the other day and she was like, "Oh my God, my knee hardly hurts anymore."
Yeah, I remember seeing you treat patients at the conference, and they'd get one treatment with you for an injury that had been around for some time. They'd get off your table and they're like, "Oh my God, I can move this, I've got better flexibility or I've got better mobility now or better range." And it was quite interesting to see how rapidly the treatment actually worked for so many people.
Yeah, well, that's one of the beautiful things about the technology is I don't have to pretend with people. Like you can tell straight away. It's no BS with it. I don't have to lie to you and go, "Oh, that feels better, doesn't it?" You're like you were there.
Yeah.
People were getting off the table and going, "Oh my God." Like people were telling me how good they felt. And if you look at our Instagram page, you can see some of these people at the conference just raving. And we were only doing like 5-10 minute treatments on these people.
Yeah.
So you can imagine what kind of effect we would have if we gave them some regular treatment on those areas. And because the main thing is it causes all these physiological changes, and those physiological changes are permanent. So one of them is what we call angiogenesis, which is the new formation of blood vessels. So if you have poor blood flow to an area of your body, I'm actually stimulating your body to lay down new capillaries in that area. So you have increased, not only just because a lot of treatments, they increase blood flow by like heat or like mechanical action. So like if I tap your muscle, I'm going to increase the blood flow temporarily to that area. Versus what Shockwave is doing, it does that for one, but it also causes the release of all these growth factors like VEGF and PIGF and eNOS and nNOS. All these things will cause your body to lay down more plumbing in the area, more capillaries to supply that area. Because that's really what it is. I tell people, think of blood flow to an area like water to a plant. If that plant isn't getting enough water, it will wither. It won't thrive. So that's for a lot of people. That's why they have these problems, is because they might have an injury that they did years ago, and that affected the blood flow to that area. And so that area can't function or heal or repair the way it used to before it was injured. And then that area kind of withers. And instead of just going to see the doctor and going, oh, my elbow hurts, give me some pills to numb the pain, stop the signal from my elbow going to my brain and my brain sending a pain signal. How about we treat the cause and then we eliminate the cause, and then you have a long-term effect from that.
Mm. And I love that. I love the fact that you're treating the root cause rather than just band-aiding a symptom, which is often what Western medicine does tend to do, right?
Yeah, it's really sad. I always use the analogy, like if a baby's crying, you would check it first, right? You would say, hey, let's check its nappy. Let's see if it's hungry. Let's see if it needs some love or needs to be burped. You wouldn't get some duct tape out and just tape its mouth and go, oh, there we go, solve that. But that's literally what we do when we take painkillers. We're telling the body to shut up. The alarm's going off saying, hey, something's wrong here. Go get it seen to. And people are just like, just take a bunch of pills. We'll snip the wires on the smoke alarm. Like, people don't really think. They just do. They want to get out of pain instead of seeing it as your body's trying to tell you something. It's an alarm system. So I look at pain very different now since I've, done a lot of work in this realm. I just look at it as, now the system can become more sensitive. So your smoke alarm, you don't want your smoke alarm going off when you light a little match, right? Because that means it's too sensitive, and that's a bad thing. We don't want that. And there's different approaches when people have this what we call hyperalgesia, which is hypersensitivity to pain, which can happen when you have a chronic injury. So Dr. McGill talks about it. If you just listen to his, he was just on Andrew Huberman.
Mm-hmm, yeah.
And Dr. McGill is one of the best back pain guys in the world. And he goes, so imagine you stubbed your toe on a table today. So that would be sore. But if you let it heal and didn't stub your toe ever again, it would heal and repair, right? So he goes, imagine if you stub your toe every single day. All right. After like a few weeks, you don't even have to, you can have the sheet in your bed touching your toe will cause pain. That's because you've irritated the area, and your brain actually will lay down more nerve ending in that sensitive area, because it goes, well, we keep getting information from this area, so it must be important. So let's lay down some more nerve endings so we can really figure out what's going on down there. And this is how this hyperalgesia occurs. It's a recurrent insult to the same area over and over and over, and then becomes hypersensitive. Because it's actually trying to protect you. It wants you to be sensitive so that you don't keep hitting it.
Totally makes sense. And I think on the flip side as well, we've really lost the art of listening to our bodies in this sort of rushing syndrome that we have of life generally, and all the noise that surrounds us in our lives, whether it's kids, work, life generally. And then, your point about the fact that this pain is a signal from your body telling you something, rather than taking a tablet, go and get it seen to, because, it's something that actually needs to be addressed, as you just rightly highlighted.
Yeah. And even worse is sometimes practitioners will tell people, oh, it's all in your head.
Yeah.
It's like, so you're saying my brain is making up this pain. And that's even more insulting. And Dr. McGill talks about that in his book. And he goes, practitioners who do that, it's because they've come to the end of their expertise. They actually don't know how to fix that person. So instead of saying that, I'm out of my depth here, they'll say, it's your fault. You're a bad patient. It's like, that's super insulting to the patient, you know?
And it happens in so many Western medical areas, whether it's, something like, joint pain to, a woman going through menopause and, a doctor saying to her, oh, no, just it'll be fine, or it's something else, rather than actually doing that deep dive and, doing blood works or trying to identify the root cause, as you said. Are there any specific injuries that Wasabi Method can't treat?
Yeah, so there are some contraindications for the treatment. So one is we can't treat kids under 18 because before they're done growing, they have growth plates on their bones. And because the shock waves cause all the release of these growth factors, they're not sure what that will do to these growth plates. So there's no evidence, there's no studies to prove that it's harmful, but there's no studies to prove that it's safe. So they have to kind of say you can't do it. The same for pregnant women. So pregnancy is a contraindication because women aren't signing up to do studies while they're pregnant to see if it'll harm their fetus, as you can imagine.
Yeah.
Other things, if people have blood clotting disorders, so if you have things like hemophilia, or you have like a thrombosis, like a DVT, can't use it on people that have those. If people are on anticoagulant drugs, so if they're on like warfarin or heparin, because it can cause them to bruise or bleed internally, so we don't want that. Other things, if they have, common sense things like don't use it over a local tumor. If someone has a tumor that's growing, again, because of the growth factors, I don't want to make your tumor grow. Bacterial and viral infections. What are the other ones? I think you can't have, so if you get a cortisone injection, so say I get a cortisone injection in my shoulder, the caveat there is you can treat that after 6 weeks. So if you got a cortisone injection in your shoulder 3 months ago, I can work on that shoulder. But if you had that cortisone injection 2 weeks ago, then I just stay away from that shoulder. I can work the other shoulder or your neck or your back, as long as I'm not working right on that area. So those are the common contraindications.
You're right. And what about if you had received a flu jab or something like that recently? Would you have to avoid that area as well, or?
Yeah, I would just for a few days would be fine. Yeah.
Mm. Are there any specific patient demographics or conditions that might benefit more from the Wasabi method?
No, not necessarily, because it has such a diverse physiological effects. It, as we said, it has that analgesic effect, which is huge. It has the angiogenesis, so we're creating new blood vessels in the areas. It causes the release of collagen, so a lot that can help with a lot of skin conditions. Cellulite, we can actually treat burn victims with their skin if you have second, third degree burns. We can help that by increasing the collagen to the area. We can cause stem cells to be released. They've even shown the release of BDNF, which is brain-derived neurotropic factor, which helps with cognition and brain function. You also get a release of, if you're working on tendons, you get a proliferation of what are called tenocytes. So they're like tendon cells that build new tendon. Another glycoprotein that's called lubricin, so it helps lubricate the tendon. You get release of fibroblasts, which help repair. They're like little repairmen. So it's like I'm stimulating your body and saying, come here, clean up on aisle 5. And your body will stimulate, will release all these growth factors, all these chemicals, all these enzymes, and go in there and clean up the mess. And the beautiful thing with it too, even if your injury is really old, say you hurt your shoulder like 20 years ago, because we're made up of living tissues, you still have living tissues in there. They've just become essentially dysfunctional. They're not working optimally. So we want to stimulate them to repair and heal. And then that area will regain function. It will become stronger. It will move better. All these wonderful things occur. even if it's been decades after the original injury or insult.
You mentioned cellulite. Did I hear you correctly? Did you say it treats cellulite as well?
Yep.
Right. Okay. I think that might catch the ears of quite a number of women. Can you expand a bit more on that?
So they've done studies, and so the two main mechanisms of action there is the proliferation of the collagen. So you increase the collagen, which it'll kind of plump up the skin, so it'll fill in those divots a little bit. But it also helps with the blood flow, the angiogenesis to the skin. So you get better blood flow to the skin, so the skin can heal and repair better, and you get better lymphatic flow to the area. You're just helping all these fluid dynamics in the area, because a lot of places in our body, particularly if we've had any injuries, the flow of all these fluids, whether it's in your lymphatics, whether it's in the fascial system, so we have hyaluronic acid and stuff like that helps these. We have layers of muscles, and they're all separated by layers of fascia, which is like cling wrap. And they all have to slip and slide and glide on each other. And sometimes when an area has been injured, or if an area hasn't moved for a long time, those two muscles will kind of stick together. Like imagine if you had two sheets of paper, they should be able to slip and slide on each other. Now, if I put a bit of glue in between them, they bind and they stick. So now I can't stretch as far, and when I contract that muscle, it won't slide past the other muscle to contract the way it should. So that restricts your range of motion, your flexibility, and your strength and contractility of the muscle.
Fascinating. I also read on your website that it treats erectile dysfunction as well.
Yes.
Okay. How? That kind of scare. If I was a guy, I'd kind of think, that sounds a bit scary to me.
Yeah. So it's very powerful for treating things like this. So we actually have a module on men's and women's sexual health if you buy our education. So one of the main things that you asked before was what makes us different. And Wasabi's much different from other companies from our education standpoint. We have really comprehensive education modules that I've put together. And for the men's and women's sexual health, I don't treat those myself. So I've gone out and hired experts to help me develop those modules. We went down to Canberra a few weeks ago to film the treatment with our expert in the area. He's been treating men's sexual health for a number of years, and he's done seminars on it and stuff. So it's really fascinating and the main mechanism there again is going back to the blood flow. So for one of the main causes of erectile dysfunction is what they call vascular erectile dysfunction. So with that, it's these gentlemen aren't getting enough blood flow to engorge the penis and maintain that. Some can engorge it, but they can't maintain it. So what they usually recommend for that is about 6 weeks of treatment once a week. So they treat right on the shaft. So if this is essentially a penis here, they would just go near the bottom, close to the tip, and on both sides. So there's 4 spots they do when they treat it, and it has quite profound effects with these men. And again, it's causing, I won't say permanent, because the studies show that it doesn't have permanent changes, but definitely semi-permanent. Like these men don't have to keep popping Viagra after, a lot of them don't have to take Viagra after the treatments, because they are able to attain and maintain an erection that will, help them have proper intercourse.
That's amazing. And given that it's semi-permanent, does that mean that they have to go into like a maintenance treatment, once a month or? Yeah,
that's kind of what the literature is showing. They actually get better results. So the original studies were showing this 6 once a week treatments, but they did another study where they did 6 monthly treatments after the initial 6 weekly treatments. And those people got better results than the people who only did the 6 initial. So they're saying if you do like a maintenance kind of treatment afterwards, that it gives superior results essentially.
And what about women? You mentioned you can also treat women as well. So how does that
Yes.
work?
So it's similar kind of concept. You can treat, one of the main ones it can treat is anorgasmia. So that's women that have never had an orgasm. Sometimes it's due to a lack of blood flow to the clitoris. So again, we can increase the blood flow in a permanent manner. So we work on these areas because it essentially it's not just at the top. It actually kind of goes around. If you look at the anatomy of the vagina, it kind of goes around underneath the labia. So you can treat all that area, and it can help these women that have never had orgasms achieve orgasms, which is pretty profound.
That's huge.
Yeah.
That's huge.
Other things, you can help some women have pain with intercourse. That can be if the pelvic floor muscles are too tense, or they have scar tissue or adhesions, stuff like that. So we can help release those muscles, and then they no longer have painful intercourse. Chronic pelvic pain, that's another one that it works really well for. Our device doesn't treat it specifically, but you can use another device called the Focus Shockwave device. Now it gets up to 10 centimeters depth of penetration. So you can actually treat bladder conditions. In men, you can treat the prostate. So these men can have this treatment after they've had a radical prostatectomy, because one of the other things I didn't mention is it causes new nerves to form. So we can help with peripheral neuropathies. So if someone's got a nerve problem, we can actually stimulate the nerve to help it heal and repair, which is really, really profound for these men having these radical prostatectomies rather, because that's one of the main reasons they can't achieve an erection, is because the nerve sending the signal to the penis just isn't working anymore. So it can't tell what's going on. The brain can't send the signal.
Right. And what about prolapsed uterus? Can you treat that as well through shockwave therapy?
I haven't seen any studies on that, but I'm sure like they're doing new studies all the time and coming up with new indications all the time. Like I'm talking to one of the best stem cell guys in the world, and we're looking at, seeing, because we cause a proliferation of stem cells. We're seeing if we use it in tandem, if they get better results if we use shockwave with the stem cell as after they've had the stem cell injections.
Cool. That'd be really interesting to see the outcomes of that. So who are you chatting to?
Dr. Adil Khan in Canada.
Yeah, right.
He was at the biohacking conference.
Yeah, that would be a really cool study to do, to see what the outcomes are of combining the two.
Yeah, because it's an adjunct. It's, as we were talking before, I usually don't treat people just with the shockwave when they come to see me. I'll do my adjustments, my mobilizations. I'll do soft tissue work with my hands. I use like instrument assisted soft tissue mobilization, which is like you use like a tool, like Graston and or Guasa. Some people call that technique as well. Red light therapy, shockwave therapy, laser. Like I hit it from multiple angles because I know I'm stimulating all these different pathways in the body, and I want to stimulate as many as I can to get the maximum healing effect on these people.
Yeah, sounds like a good approach. What are some of the common misconceptions or myths about shockwave therapy that you can put to bed?
Well, one is people think it's electric because it feels like it's an electric kind of stinging sensation.
Well, the word shockwave, you straight away associate it with that, right?
Yeah, or the word shockwave. Yeah. So in the States, we can't use that term because of the FDA approval it's under. So it's actually, we use the term radio pressure wave therapy.
Okay.
Yeah. So it's technically the device doesn't get to the minimum required threshold to be called a shockwave, but it does the exact same thing. It's just the energy is a little bit lower.
And I can confirm to our listeners, because I've I've been treated by you at the conference, and no, you do not feel like you've been zapped by electricity when you have the treatment.
Yeah. It just stings a little bit because the actual head is kind of moving like a jackhammer. So it kind of pinches the skin a little bit as it's moving.
Yeah.
Yeah.
Describe for us a case study or patient success story where the Wasabi method was particularly effective. I'm sure you had quite a few at the conference.
Yeah. So, well, one that I commonly use at seminars that I teach is I had a patient a few years ago. She came to see me, and she had plantar fascia or plantar fasciopathy, which is the bottom of the foot. It's just beneath the skin, and it's quite painful. It makes it really difficult to walk. They feel like they're walking on broken glass. It's
quite common too, isn't it?
It's super common. And it's really poorly treated, which is quite a shame because I have a very high success rate with treating these people. So this lady, she had been to, I think she said 10 practitioners over 2 years and had spent over $10,000 in therapy and was no better. And this is when I used to work for an orthopedic surgeon in Sydney, and she'd actually seen a chiropractor who harmed her. Like, I think he caused a fractured rib or something like that.
Jeez.
So she wasn't too keen to see a chiropractor. But the surgeon was like, "Go see Adam, he'll help you." And she was like, so when she came and saw me, she was like, "Oh yeah. I was just going to be practitioner number 11 on her list of failures." And she was about 65, I think, at the time. And she hadn't seen her daughter and granddaughter were living in Hong Kong. And she hadn't seen her daughter or granddaughter in almost 2 years because of her foot pain, because she couldn't walk around. Because again, like I said, it feels like you're walking on broken glass. So you're not going to walk, all of hundreds of meters on broken glass, are you? So I started treating her, and after a few treatments, she was like, "Oh, I think there's something happening." And I think it was about 8 treatments. I was doing once a week for about 8 weeks. She was on a plane to Hong Kong by week 9.
Amazing.
So she was actually I remember speaking to her, and she was actually pissed off in a way, because she was like, "How were you able to sort me out? And I spent all this money and saw all these other practitioners." Like, she was upset that she had seen all these, so-called qualified professionals. And it's like, how come? Because clearly there's a way to treat it successfully. And she was upset that none of these other people knew how to do that. And she'd spent 2 years and $10,000 down the drain because people weren't treating this effectively. Yeah. So I tell people it's not those practitioners' fault per se. You only know what you know. And if they're not aware of this technology, or they're not reading peer-reviewed journals to learn about this, or listening to podcasts and stuff like this, they're just oblivious. They have no idea. Like, a lot of doctors will just do the, cortisone. The options are pills, needles, and scalpels.
Yeah.
Those are the only 3 things that exist to treat anything. And that is completely false. And then that really irks me, that people aren't given what we call informed consent. Informed consent is, you are required as a professional, I am required to tell you all the options. Just like if you go to a restaurant, you want to see the menu with everything.
Yeah.
There's pork, there's chicken, there's lamb, there's beef. If it's not on the menu, you don't even know it exists, do you?
No.
You're not going to order beef if it's not on the menu, because you go, "Oh, well," you're going to assume it's not available. So that's what happens in a lot of cases. And people either don't get better, or in some cases they end up worse. They go get a surgery and they can end up worse. I'm not saying that happens all the time, but when you do something that's invasive, that's permanent. You can't undo that.
Yeah. Yeah, it doesn't happen all the time, but it happens quite a lot. And I could probably rattle off a number of people on one hand that I know personally who have had to go have surgery and actually ended up worse off as a result of that surgery.
I've had loads of patients.
Yeah.
And I'm not here to hammer Western medical ways of treatment. I'm just saying they are not infallible.
No.
They have this attitude that they are. I've come to recognize that they don't want to admit their shortcomings. So they have this, we got this. We know how to treat all this stuff. And then I'm like, well, I've looked at your track record and it's not too good. So you clearly haven't got this.
And like you said, well, they don't know. They don't know.
Exactly.
They're not trained in everything.
No.
As an example, most GPs aren't trained in nutrition. They might do one small module as part of their university degree. So it's, I think, this godlike view that we have of Western medical professionals kind of needs to change because they don't know everything.
No. And I don't think anyone expects them to. Like, if you ask any patient, do you expect your doctor to know everything and be infallible? And they'd be like, no, he's human, isn't he? Or she. They've almost backed themselves into a corner now where they've had to portray that image for so long that they can't backtrack now.
Yeah.
They really can't. They're stuck in a corner with, this is just, we have to keep on playing this hand.
Yeah.
And it's a real shame because if they actually put their hand up and said, hey, we're actually not that great at treating this, we're open to learning and trying new ways, then, other practitioners from other areas could help them. Like when I worked for that orthopedic surgeon, he was really open to what I do. And he was saying he did his training in Germany. He goes, there's surgeons in Germany who actually go to chiropractic school to learn how to manipulate.
Yeah. Yeah.
And we almost do the opposite here in Australia, where I've had doctors actually tell patients of mine to stop seeing me because I was going to harm them. And I'm just like, are you serious?
Yeah.
Like,
ridiculous.
It's ridiculous. Like, the chiropractic's been around for 130 years. Like, if we were actually harming people and, breaking people's necks and causing strokes every week, do you not think the government would ban us real quick?
Yeah, exactly.
Like, it doesn't make sense. Their arguments don't make sense. So I just, sorry for getting up on my high horse, but I just...
No, I love it. I love it.
It's just so frustrating when people aren't given, and a lot of people could benefit from these non-invasive treatments.
Yeah.
There's more and more research showing conservative methods of treatment are just as effective as a lot of surgeries. And Dr. Stu McGill talks about that in his podcast with Andrew Huberman. He said he does this, he calls it a virtual surgery.
That's right.
He sits them down and goes, there you go. You just had surgery. We're going to pretend we're going to treat you exactly the same as someone who's had surgery. You're going to do the exact same protocols. You're going to do the same rehab. We're going to do everything the same. And you know what? He said when I went to a seminar, he said, guess how many people I have to send to the surgeon? And everyone's guessing. We're all like, and he said, remember, I only treat the worst of the worst of the worst. He goes, all my patients are failed cases from other practitioners. So he said, guess how many I actually send under the knife? And we're all guessing like 70%, 80%. He goes, 5%.
Wow, that's low.
So he said 5% of his patients he sends. So I was saying it wrong before. 70%, 80% didn't require surgery. So he's saying he was able to successfully treat 95% of the worst case scenarios of back pain.
That's so good.
If you imagine how many people are actually having surgery that don't require it. If he's fixing 95% of the worst cases, he goes, guess how many of these patients come to me with a referral for a surgeon already? He goes, 100%. He goes, every single one of them walks into the clinic saying, if you can't fix me, Dr. McGill, I'm booked in for surgery next month. Every single one of them. And often it's a second, third, or fourth surgery.
Yeah, that's some pretty alarming stats there, isn't it? Really, when you think about it. I think back to what you were saying about, doctors not being everything. And it applies right across the board, doesn't it? Because if you go to a chiropractor or an osteo or a massage therapist, whatever, if they can't help you they've got other options that they can leverage off, and they do normally recommend that, right? Like with the Wasabi Method. So you've got that, as you said, in your toolbox now, and on top of being a chiro. So it's about, really being transparent, I think, and open about whether you can help someone or not, whether it's through conventional treatments or whether it's through more innovative treatments like Wasabi Method. I think that, I think we need to see more of that transparency and holistic approach to treating patients.
Yeah, I totally agree. And this, like I said, this multimodal approach works really well. These are all adjuncts. I don't just shockwave people. I do the soft tissue stuff. I do the joint manipulation. I give them exercises. I use kinesio tape. And it's the best way to do it. And I don't really care. And the problem with that is we can't really do a study because there's too many variables. If you know how to conduct research, you can only measure so many things. So if I'm doing 5 or 6 different therapies on someone, we can't attribute the benefit to any one of them. But as Dave Asprey says, like if you're baking a cake, you don't just use flour. It's like, let's test the flour. Oh, that's not a cake. Let's test the water. Oh, that's not a cake. Let's test the eggs. Oh, that's not a cake. Let's test the baking powder. Well, try mixing them all together.
Yeah.
Oh, now we've got a cake.
Yeah. And it makes sense, right? When you use that analogy, taking that holistic approach, multimodal approach to treating something, then as long as you're getting the outcome for the patient that you need to achieve, that's the ultimate aim.
And patients don't care. They're like, as long as you, they'll say it to my face. They're like, as long as you get me better, that's what I'm here for. That's what I'm paying for. I don't care how you do. If you got to get a magic wand and wave it over me and that makes me better, I'm all for it.
And if you can avoid having to go under the knife, even better, right?
Well, exactly. Again, with these non-invasive treatments, the side effect, the risk ratio goes way down. Like with Wasabi, like usually the worst thing that can happen is you might have some soreness. You might have a little bit of bruising in really rare cases. And yeah, that's really it.
Yeah.
And then you follow the contraindications. Obviously, you're not going to put it on your eyeball. You're not going to go right over your lungs. Oh, that was one of the contraindications I didn't mention is you can't go over the lungs.
Yeah, fair enough.
Yeah. You're not going to fix your cataract by putting the wasabi.
You're not going to poke yourselves in the eye with it, right?
Yeah, don't do it.
So it sounds like you have to have a few treatments. What kind of preparation or aftercare do patients need to follow when undergoing treatment with the Wasabi Method?
There's really nothing special they need to do. Usually, if they're a bit tender or sore after treatment, we usually recommend that they don't do anything strenuous. So like if I work someone's elbow, I'll be like, okay, just if you go to the gym, just do some cardio, don't sit there and do a bunch of arm curls and bench press. Give it some time to settle down because like I said, it does cause a little acute inflammation, but that's desired. We want that because we're stimulating healing to the area. And that's how we stimulate that healing. We have this chemotactic effect by stimulating an area and causing a little bit of inflammation.
Okay, so that's one of the side effects from having the treatment. Any other side effects a patient could expect?
Nope. No? That's really it. Like even some people like I myself, when I get treated, I feel great right after. Like I actually feel better immediately. But there's different responses. Like, because people go, how should I feel after? I go, there's 3 options. You'll feel worse, you'll feel no different, or you'll feel better. They're all possible outcomes. It depends on how long you've had the problem, how sensitive the problem is, how your general health is. All these things, all these factors come into play.
Yeah, right. Okay. How has the Wasabi Method evolved since its inception? And what innovations or improvements have been made since you first started developing it?
So one thing we've improved is, so in the United States, we're allowed to sell to non-medical people. So lay people, essentially. So you don't need to be a chiropractor. You don't need to be a physio. You don't need to be a massage therapist or a doctor. The caveat there is you can only treat yourself. All right. It's good. So it's a liability thing. So if you're not a trained professional, you can't treat others because if you harm them, they can sue you. So what we've done is originally I had developed education modules that were for medical people and professionals. And I was like, the language that I use to teach medical and allied health practitioners is different. I can use all my technical and the Latin and Greek words that we all learn at university. But if I use a lot of those terms for non-medical people, they won't be able to understand what I'm saying. So I took everything that I had done and I'm rewriting it for non-medical people. So I'm making it easy for people that have no steeping in anatomy, physiology, biomechanics to learn how they can treat themselves. And then we have videos. I have videos of myself showing exactly. And the cool thing is I'll show you exactly how I would treat myself. It's like, this is how I do it. Now, it doesn't mean it's the only way, but it's one way that I know works. And so that's super helpful. Like the company I worked for 12 years, when I bought the machine, I had a salesperson who had no professional training. He was just a salesperson. I had 1 hour with him. He was like, okay, this is how you turn it on. This is how you clean it. This is how you use it. Off you go. I'm like, are you kidding me? So I've gone to the other end of the spectrum. I actually, when we sell devices to both professionals and non-medicals, I will do a 1 hour telehealth with them. So I run through it with them. I go, this is how you turn it on. This is how you clean it. This is how you use it. That's on top of all the other customer service we give these people. So we're in contact with every one of them. We have a membership where you can join and do monthly talks where we have special guests talking about different indications, different treatments, learning about all these things. And yeah, we're small and nimble, so we can really address any problems that people have. It's like I tell these people, like, I'm the CEO. Like, I didn't even meet the CEO of that company that I worked for 12 years.
Just the salesman.
Yeah. So, like, I'm happy that I'm able to do that. Now, I'm sure we'll get to a stage that I won't be able to do that if we have.
Yeah, you're not going to be able to do this.
Yeah, yeah. If I have 1,000 people a month that want to do, 1 hour consults with me, I can't do that. But yeah, that's currently what we're doing, and people love it. I had one this morning, and she was a chiropractor in Oklahoma City, and she was super happy with that. Like, I answered all their questions, and any question I couldn't answer, I said, just email me, and I'll research it, because I have a team of experts that I can ask, and they help me, and yeah, it's great.
Do the additional research and studies if there's something new that comes up.
Like, I got world leading experts in this field that I can tap on the shoulder and say, hey, what about this?
Awesome.
Which is really fantastic.
Yeah, totally. So individuals and medical professionals can purchase it in the States. In Australia, individuals cannot purchase it?
No, we don't have it for sale in Australia currently.
Right.
Yeah.
Why?
Yeah. Oh, it's a TGA thing, so we have to.
Oh, the TGA thing, right?
We have to jump through the hoops and.
Yeah. Okay.
Do all that stuff.
I was going to say, like, where could you get Wasabi Method treatment here in Australia?
Yeah. Currently, you cannot, but we're looking to change that in the future. But it might take a little while.
Yeah. Well.
But you can still purchase the education. So even if you use, so that's something that I tell people as well, is if you have another, like a competitor's Shockwave device, that's cool. We're still happy to send you if you purchase it, obviously, we'll send you the learning modules, because these other companies don't have this. Like I said, they don't teach you any of this. And I have, like, for the upper limb module, I have 86 different indications. So I go through 86 muscles, tendons, ligaments, nerves, and I show you exactly how to treat it. Like what settings to put it on, how you move it, how you position the patient, how the practitioner stand, like comprehensive. We have beautiful anatomy pictures. We even have videos, like 3D videos to show you the anatomy really well. I'm very, very, very proud of the product we've made.
Yeah, awesome. And if I recall correctly from the biohacking conference that we attended in Dallas, you've even started to get interest from health spas and gyms and
Yeah.
those sorts of businesses as well, right? Really looking
Yeah.
at ramping up what they can offer their customers.
Yeah, so a lot of these health spas over in the United States, which is a very cool concept, they use all this biohacking technology to help people. So they'll have ice baths and they'll have infrared saunas and they'll have red light and they'll have PEMF and all these wonderful therapies that are super effective. And a lot of them want Shockwave as well because it fits right in there with all that other stuff. I would love to have some of those things, like the PEMF. I'd love to have one of those in my clinic.
I know, right? Same. That'd be very cool. There was some great tech at the conference to check out.
Oh yeah, awesome stuff. And it's just a shame that most of Australia is completely oblivious to this stuff. Like when I talk to patients, they don't even know what biohacking is.
I know, right? That's the thing. I've come across the same thing as a biohacker and a biohacker influencer here in Australia. It's if when I speak to people and they, and I tell them I do biohacking, they're like, huh? What's biohacking?
Yeah, what's that?
I've never heard of that before. I mean, I think it's starting to improve, and I actually wrote an article about this, which will be going into the Biohacker magazine in the States soon. It's starting to grow, but it's not at the level that it is in the States. We're doing things like forest bathing, ice plunges, infrared saunas, that sort of stuff. But when you look at the tech that we saw and got to try out over in the States, I mean, that was super cool.
Oh yeah, they're easily 10 to 20 years ahead of us,
Yeah.
But that's just kind of how Australia is. It's we're late adopters to almost everything. And that's just what happens. So I prefer to be an early adopter because I like living in the future. And, this stuff's cool and it's beneficial. But I always tell people, do your homework. Don't just watch a video or subscribe to some narrative or whatever you've heard. Like, do some actual research, type things in PubMed and actually vet these things a little bit. Sometimes these things they're so new that there isn't any research. So just because, what do they say? What's the saying? Absence of evidence isn't evidence of absence.
Mm-hmm.
Like there's no studies showing that jumping out of a plane without a parachute leads to death. Right?
Yeah.
But I don't really need one.
Well, when you think historically, even looking at medicine, or even just general things around innovation, centuries ago, we would not have the flu injection. We would not have so many different technology, medical treatments if somebody did not try it at the time, right?
Exactly.
And I think Dave spoke about this at the conference as well. I recall him raising this, just because, it hasn't been done, or just because it's new doesn't mean that it's not, that we shouldn't try it, or that it's not going to work.
Or that it's not possible. You know, like in 1899, it wasn't possible to fly a plane.
Yeah.
And then the Wright brothers changed that a few years later.
That's
so they actually achieved the impossible.
Yeah.
Right?
We used to light candles before instead of flicking on a switch.
Yeah, exactly.
So many different, great innovations that have occurred over the centuries, and it just takes great minds to try.
Yeah, because people were curious and people wanted to test the boundaries of what can be done. And I applaud that, because we wouldn't have all this cool stuff if people weren't willing to be pioneers and entrepreneurs.
Yeah, completely agree. A couple more questions for you before I let you go. Other than the Wasabi Method, what are your favorite biohacks?
I love infrared sauna. I have one at home. So I have a full spectrum clear light infrared sauna. I go in that probably 4 times a week. So that's one of my favorites. I do like ice baths as well. I haven't been as consistent with it. Well, it's cold here because it's wintertime. So I just put the shower on full cold, and that's pretty cold.
Yeah.
What else do? I do red light. I have red light therapy panel. I do that. And I do breath work. So I do a breath work class once a week, and that's about an hour and a half, and that's profound. Wow, that's made some huge changes for me.
Has it?
Yeah.
In what way?
Oh, it's just like therapy. It's, like I feel like one session of that is like 6 months of getting psychotherapy.
Wow.
Like it's profound, because you go to an altered state of consciousness and you can just work through a lot of stuff. Yeah. If you get someone who knows what they're doing and helps you, guide you, and it's a safe space, it is profound.
Yeah, I've done it before and I've had a similar experience as well.
Yeah.
Yeah, it's pretty cool. Pretty cool hack to do. What does it mean to you to live well longer? Live well longer.
Oh, well, I automatically think of, health span versus lifespan when we're talking about that. So, I think you've read Peter Attia's book where he shows the curves. It's like you want to be healthy and fit until you're 99 and then die 12 months later.
Yeah.
Right. So that's kind of what I would love to have for me. And I think the problem for most people is they don't see that it's an ongoing thing. Health is not given. It is achieved. You have to work at these things. And unfortunately, a lot of people just take it for granted until it's gone. They'll just, she'll be right, especially in Australia, and particularly men. I get so many men that she'll be right kind of thing. And I'm like, dude, no. It's like, you have something wrong with you. Like, I've had so many men where I've had to have this conversation with them and be like, dude, you're going to mess yourself up in a permanent manner if you keep going. Like when some of these people with back pain, you're going to have surgery and maybe never work again. Like, they don't really get it. It's like, oh yeah, she'll be right. And I'm just like, no, like, take this seriously. You need to take care of yourself. Who was it I heard? Dr. Terry Walls. She talks about that. She goes, either way you have to pay. So she said, you can either pay now and eat healthy food and go exercise and go do this biohacking stuff and reap the benefits from all that good behavior. Or you can wait and do nothing, wait till you get so bad that you have to have surgery, you have to have drugs, and you're in pain all the time and you can't go to work. And it's like, what would you like to do? Option 1 or option 2? Because that's it. There's only 2 options.
100%.
So that's what I tell people. It's like, why wouldn't you choose option number 1? Because if you don't choose option number 1, you default to option 2.
Yeah, completely agree. Well said, Adam. Thanks so much for your time. Great to chat.
Thank you so much.
Well, that's a wrap for today's podcast. Thank you for tuning in. And if you'd like to learn more about biohacking, go ahead and sign up on my website at www.biohack-her.com to get a free copy of my 5 top biohacks to get you kick-started. While you're there, you can also check out my blog page for more tips on biohacking. If you'd like to subscribe to this podcast, you can do so on Apple, Spotify, and Google Play. Let us know if there's anyone you'd like us to talk to in particular, and we'll endeavour to get them on the podcast. Until next time, remember to live well longer.